Hello, everybody. It's Phil Jacobus. It's September 11th. I'm in my office in New York City. My office is in Lower Manhattan, and today, as I was walking to work, I saw all of the firemen and policemen and military personnel there for the ceremonies remembering the attack on the World Trade Center on September 11th, 2001. It's a very sort of a very sad and poignant day for us here in New York City. And we must all remember the people who died on that day. On a more positive note, today I'm going to share an interview that I pre-recorded with Sonia Singh. Very interesting story. I know that you'll enjoy it, and she's has very interesting insight. So, but before we visit with Sonia, let's take a look at a few of the stories that appeared in today's Healthcare Business News Online. Here is a story about focused ultrasound, and focused ultrasound is really cool technology. It's cutting edge, and it's really. I encourage you to read this story if you're familiar with focused ultrasound or not. You'll learn something. Another interesting story as it relates to COVID-19. This is a story where some industry stakeholders talked about what is a really big concern as it relates to COVID-19. This is what's happening in the country, so I encourage you to read this as well. So today I have the good fortune of being able to welcome Sonia Singh, who is the Vice President for Avia, and her actual area is the Center for Consumerism. Is that correct, Avia? Or is that correct, Sonia?
That's right, Phil.
And, Sonia, some of our viewers may not be familiar with Avia, so could you give us a sort of an overview of, and thank you for joining us. We're lucky to have you, so forgive me for that. And can you give us just a little from up in the air, a view of what Avia is all about?
Absolutely. So Avia is an innovation partner to a network of health systems who are really focused on using digital as a transformative lever to achieve their strategic objectives. So whether that's consumerism and how do you build a great consumer experience, or whether that's how do you transform your operations with digital, or how do you transform care delivery, those are all the areas we focus on with our members. We have about 50 or so health systems in our network that we are constantly working with to advise them and bring them digital innovations and really be their digital transformation advisor broadly.
I see. And you work with the stakeholders in the hospital and help them to find, I assume, vendors that offer these kinds of services.
We help them to find vendors, but even upstream, we also help them frame the space, the problem, help them make the business case internally. Sometimes there's stakeholders to be aligned and a strategy to be built around what is your digital roadmap. And then ultimately, yes, there are vendors and solutions that are out in the market that need to be brought in to fulfill some of those digital aspirations.
Okay, so today I think we're going to talk a little bit about contactless visits, which all of us, I guess, recently have experienced, and we're having a contactless visit right now, and you're knowledgeable in that area. Why would, aside from the obvious reasons, why would healthcare providers be interested in contactless visits? What are some of the reasons?
Yeah, there's a few key reasons why we are seeing health systems invest in this. One, we know that consumer confidence and patient confidence continues to be pretty low. People are afraid to come back to care. There's been a really steep decline across specialties in different types of patient visits. And this is it's tough from a volume and revenue perspective. There's been a little bit of like coming back to earlier volumes during the summer, but a lot of systems are expecting that we will drop back again in the fall as flu season and potentially future surges come up. So that's one reason. Second reason is as people are deferring care, they're presenting late, and that actually has health outcome issues. So if you put off preventative care, you're skipping important diagnostic procedures, you may be avoiding the ED. We have been hearing stories of, parents keeping their child with burns away from the hospital for 3 days, or people having heart attacks at home. These are really bad health outcomes as people are deferring care because they're afraid to go in. So that's another reason. And I would say maybe the final reason is we're actually even seeing a significant staff turnover in health systems, particularly front desk staff and others who have to interact with patients in person quite a bit because they are afraid and they don't want to take that risk too, and they're burnt out. So given all these factors and knowing that we want to keep our communities healthy, we want to bring back volumes and revenue as a health system, we want to keep our staff and providers feel like they can be part of a safe and secure work environment. How do we reimagine what that in-person visit looks like by enabling this idea of a largely touchless or contactless experience?
Yeah, thank you. Those are intuitive, but you verbalize it in a great way. So thank you for that. What sort of technology exists and how are hospitals incorporating it, and what works and what doesn't?
Yeah, so we have been looking at technology and solutions across the patient journey. So if you think about the pre-arrival space, the arrival space as people are coming into the facility, the actual entry, and then the encounter, and then the post-encounter, right? So in the pre-arrival space, it's notifying people of locations and clinics that are now open, really being able to digitally enable that sort of communication and remind people like, hey, you may be afraid, but listen, this is what we're doing that's different. This is what it's going to feel like. These clinics are open. This is how we're changing our work staff and our schedules, and this is what it'll look like. Helping them to schedule appointments too digitally. So if you're constrained with staff, how can you enable more online scheduling? So there's solutions, technologies around that. Things like reminders and backfilling, so that as your appointment is coming closer, like you get a reminder 2 days out or a day out, that actually increases the potential of people actually showing up in person for the visit and not canceling or no-show. So what are technologies to support that? And then even doing some of the registration and forms and screening work pre-visit at your home. So these are typically things that you'll be in the office visit or in the facility filling out paper forms, and to reduce some of that contact with forms and people, like can that be done digitally at home? So that's all the pre-arrival stuff. There's a lot of digital solutions that do all of those things that I talked about. Then in the arrival space, I will say we're seeing a lot of market movement in this area of health systems, taking this the arrival space very carefully and making investments. And this is, think about as people are arriving to the facility, you will still have to do some in-person visits, whether that's labs or certain types of visits, but as they arrive, instead of the traditional method of, you go into a waiting room, a crowded waiting room, and you interact with other patients and front desk staff, how can you actually enable people to check in, do all of that waiting outside of the facility, provide real-time geolocation, wait time management, queuing, productive waiting, education, all of those things that can be done outside of the facility, so you minimize or create this contactless or touchless experience, but it's very similar, but it's digital. And so this idea of virtual waiting room, I would say, is one of the things that is, a lot of health systems in our network and outside are investing in. So virtual waiting room solutions, you come and you wait in the car park or you wait somewhere else, but outside the facility, and you can interact with the staff outside, and you only come in when it's just the right time. So there's a lot of solutions on that. Then you think about the entry, so the actual coming in physically into the facility. There's a lot of solutions around screening and surveillance. So now if you have been going to any facility or restaurant, you will find that, people are taking a temperature scan out of your forehead or your wrist. How can you automate that? So people are, we're seeing health systems install thermal cameras at the entrances that can automatically screen for temperature and other symptoms, and then direct people without having a physical person there to do it, direct people to different routes based on the symptoms they're having. So you can, at the entry level at the entry of the facility, be able to navigate people to different routes. And this is both for patients, caregivers, and employees. So we're seeing people do that sort of installation of that sort of technology. Then you think about in the actual visits and navigating in the facility. So things like wayfinding and navigation, whether that's app-based or you can do it via text. You tell people, okay, this is how you would navigate to the next room. Here you might want to get your labs. And taking people through that itinerary, which gets very personalized. So if I'm coming in for a series of couple of appointments, I have to do my labs. How can I do that without having to interact with the staff through that process? So traditionally you'd have a person, a front desk staff, maybe a patient service rep who would navigate you to those different rooms. Now it's time to go to room A. Now let me walk you over to where you get your lab. So how can you do that in a more autonomous way through technologies like wayfinding and navigation and workflow automation that keeps the efficiency in the workflows, but also creates this touchless experience. And in the post-visits, a post-encounter space, we are seeing things like contactless payments. So instead of, again, interacting with the person at a front desk, can you use apps and solutions, digital solutions that enable you to just pay through a text or through your app, etc. So that kind of crosses that whole journey.
That's extremely interesting. Yeah. We don't have a lot of time left, but there are two questions I'd like to ask. One, how do healthcare providers make the patient aware of this? If you can tell me briefly.
A lot of it is marketing campaigns. So letting people know that this is what the visit is now going to look like. It's going to feel and look different than what you've experienced before. And this is why we're doing it. It's to keep you safe, it's to keep us safe, but it's not going to compromise the actual nature of the visit or the care that you will receive. So people do that through, their websites. People are doing it through outreach mechanisms, like text is being used pretty widely. So you can set up different outreach segments and then reach them via personalized text messages, and people can text back and be like, oh, really? Can I schedule something? What else should I expect, etc. So create that sort of bi-directional digital communication for that.
Okay, and the $64,000 question, I just picked that number out of the air. An important question I'd like to ask is, what about the future? Will this, going forward, is this the way things are going to be? Or after we've solved the problem of the pandemic, please God, will it go back to the way it used to be?
Such a great question, Phil. No one can really predict the future, but I can tell you what I have been seeing and observing in the field as I work with health systems. Most health systems who are employing an approach like this really have the philosophy that we don't just want to recover, because recover implies that we just go back to the old ways. But they've been using language like, this is the time to reimagine, or this is our go forward strategy. So they're really thinking about not just going back to what we had, and this is a temporary fix, but really how do we reimagine the care experience and use digital to create new efficiencies, maybe improve the consumer experience. And what's really interesting is also, as this happens, health systems are really thinking about how to reallocate the physical space they have. So as you do less in-person visits or you reconfigure them, you might repurpose the physical space. So those are decisions that are hard to come back from too, because you might have other uses for the space. You might lease it out, you might do other things. So those are some of the conditions that create permanency in some of these things. But I personally believe that people will start to see how this is a really enriching staff and consumer experience. There's more efficiencies in the workflows. we might discover new opportunities along the way. And I think that is what's going to keep these from not returning back.
You know, I watch a financial television show every day starting at 6 a.m. and a fellow there mentioned how we've compressed the implementation of technology that probably
Yes.
would have taken place over 10 years into just a few months. And
Yes.
he
Yes.
thinks we're probably not going back. And I know that I'm the proud owner of a Medtronic pacemaker, and I have to go in periodically. And the hospital sent me a text and asked me if I had any symptoms or COVID, and I said no. And the hospital allowed me to go onto their special portal. I won't mention the name, and I was able to schedule my appointment and answer a whole bunch of questions, just like I said. So I predict, and I'm not as smart as you are or as knowledgeable, but I predict that we'll never go back.
I hope so too.
Sonia, you are one of the most interesting people I've spoken to in a long time, and it's my pleasure to speak to you, and I'm sure that everyone will enjoy this interview. So thank you very much for joining me.
Thank you so much for having me. This is a great topic to talk about. Had a great conversation today. Thank you.